I'm Dr. Sarada Pasangulapati. I'm a gastroenterologist at Yashoda Hospitals, Somajpura. Today we're going to talk about a procedure called endoscopy. The reason this topic has been chosen is a lot of people know about endoscopy, but they don't know what it means and have a lot of misconceptions often about the procedure. So what is endoscopy? Endoscopy is a tube with a camera at the tip of it and a light source at the tip of it, which is passed down the throat into the food pipe, into the stomach and the first part of the small intestine. So this will help us examine the insides of the food pipe in the stomach. So this is essentially to look for things like ulcers, gastritis, or any other serious problems. Now, this procedure can be done with or without anesthesia. So that is the first thing most people think, oh my God, this procedure can only be done without anesthesia. It becomes very uncomfortable to swallow. There is vomiting during the procedure. There is pain during the procedure, etc. So first of all, it is usually a well-tolerated procedure, comfort-wise as well as risk-wise. Comfort-wise, we give a spray to numb the throat so that patients don't feel the camera going through, although they'll be aware and alert and will be able to swallow the tube, which goes through just like swallowing food. But some people do retch during the procedure and have a severe gag reflux. So as soon as it hits the back of the throat, some do have the sensation of vomiting, but most are just fine swallowing it. So once it goes into the stomach, we pump in a bit of air so that the stomach distends nicely so that we get good views of the stomach. Once the scope goes through into the small intestine, we start coming back and do some maneuvers in the stomach and then come out. The procedure usually lasts less than 5 minutes, even if it involves taking samples. So 1 or 2 samples, what we call biopsies, can be taken well within the 5-minute period. We tend to keep this procedure short, and unless there is a problem that we need further evaluation or detailed evaluation, usually it lasts around 5 minutes. The other way of doing this procedure is by giving anesthesia. What we mean by anesthesia is conscious sedation. So patients are usually conscious and are able to breathe, are just comfortable or coping better with the procedure. There is a third type of sedation, which is unconscious sedation. So a short period of sleep. So a very short acting anesthetic is given. Again, patient is self-ventilating, which means they're breathing by themselves. We monitor the oxygen levels, etc. during this process, monitor the heart rate and everything. Patients are just put to sleep for a very brief period, like 10 minutes, and then they're monitored afterwards. There are, however, risks to this procedure, and the risk depends mainly on the age as well as the condition requiring the endoscopy. So the doctor will have detailed discussion about the procedure as well as the risks prior to performing this procedure. So when I say it is usually well tolerated, the risk of complications is rare, like 1 in 1,000. So most patients are fine with it. If a doctor recommends endoscopy, one must have a detailed discussion as to the risks versus benefits of that procedure in that particular patient, given the condition, and then proceed with the test. Thank you.
Like, comment, and subscribe for more health updates.